everybody, welcome back to another video. As you can tell by the title, I'll be telling you guys the pros of working as a nurse in the NHS, and also I will share some advice with you. These may be helpful if you're a newly qualified nurse or if you are even a student nurse. I will firstly start with the pros of being a nurse in the NHS. When you apply to work as a nurse in the NHS provides you with a set of uniforms. If you are working full-time, you are usually offered 3 sets of uniform, and this is the basic tunic shirt or dress. Another pro of working in the NHS, especially when you are newly qualified, is that you are given the preceptorship course. This preceptorship course or period usually lasts between 3 to 6 months, depending on what hospital you are working in. During this preceptorship, you are the preceptee and you are assigned a preceptor. This preceptor is usually a senior nurse and she or he will help you settle in. During your preceptorship time, it is a good time to ask as many questions as you can to the senior nurse that's assigned to you, so that once that period is over, you are comfortable working in the ward or the department that you are in. Another pro of working as a nurse in the NHS is that you are given regular trainings. The NHS already provides regular trainings which are mandatory, such as basic life support, but it also allows you to do trainings such as blood transfusion, cannulations. Working in the NHS, there is a real opportunity for you to further in your career and achieve greater things. Moving on from furthering in your career, working in the NHS as a nurse is beneficial because when you first start, you are classed as a Band 5 staff nurse. From here, in the NHS, you have the opportunity to become a Band 6 nurse, which is senior or charge nurse, then a Band 7 nurse, which for example could be a ward manager, and if you want to, you can carry on forward to a Band 8. A Band 7 and Band 8 can involve working in a research setting or a clinical setting, or the management side and even educational side of nursing. So there are real opportunities, and many of them, when working as a nurse in the NHS. Another very important benefit of working in the NHS as a nurse is the holiday. Working as a full-time nurse, you are allowed about 6 to 7 weeks in total throughout the whole year, and these holiday weeks are all paid. Also, the longer that you work in the NHS, the longer your holiday period is extended for. For example, in your first year of employment, you may only get 6 weeks of holiday throughout the whole year, but if you've been working for another 5 years, it may increase to 10 weeks. Okay, so I'll move on to some advice. So whether you are a student nurse just going into your placement on the first day, or if you're a newly qualified nurse going into a new ward, my first advice to you is to list out the common medications and conditions that are usually going to appear in those departments that you're working in. For example, if you're going to be working in cardiology ward, then it could be helpful for you to go through a list of common cardiology conditions such as MI, atrial fibrillation, and common medications such as the type of blood pressure tablets and anti-cholesterol tablets. Another thing that I advise you to do is to make sure you know the patient to nurse ratio. Sometimes you may go onto the ward and you may be overwhelmed with the amount of patients that you're looking after. And so to prevent this overwhelming feeling on your first day, I suggest that you ask your manager what the patient ratio is to the nurse. Another advice that I would give to you, whether you're a student nurse or a newly qualified nurse, is that I'm aware that different hospitals, different wards will have a little bit of a different handover system. What I mean by handover system is the piece of paper which is your handover layout will be different in each place that you go to. And so once you start working, it is a good idea to become familiarized with this handover sheet. A promise that by you understanding your handover sheet, it will really help you get along in your work, where you are able to understand what the patient's conditions are, what the management plan is, and what you've got to do as a nurse. Whether you are a student nurse or a newly qualified nurse, or even a nurse that's worked for a long time, it is important to take notes. Our brains can only take so much information in, and our shifts are about 12 hours long. Each shift is very busy and things can get mixed up and lost in our minds, so it's important to take notes. For myself, during every shift, if there's anything that I need to remember or any tasks that I need to do, I write it down in my handover because it's always going to be with me, there for you when you need it, and you can always refer back to it. You can even carry a little A5 notepad with you and you can keep all of your information there. Obviously, carrying your A5 notebook, it is important that it does not get lost, and also it is important you maintain confidentiality. If you're a student nurse or a newly qualified nurse, it is important that in your first few days and weeks of working in the area, that you ask as much questions as you can. Also, try and be as proactive as you can. So for example, if you see a procedure that is going to be happening, then ask your senior nurse if you can take part in it or if you can observe, so you can enhance your learning and understanding and increase your nursing clinical skills. Extending on from participating, you need to make sure that you know your limits. So when you are carrying out a procedure, do not feel that you need to do it unless you have the competency and the confidence to do that procedure, because patient safety is important. Also, another advice is that after each shift or throughout your shift, it is good to reflect on the things that you have been doing. This can be a sign of your progression. An advice that I would give to you, whether you're a student nurse or a newly qualified nurse, is stay up to date. Now you can do this whether that's looking on the medical board or talking to the medical doctors or the other nurses working with you. Or another way I like to keep up to date with what's happening in the shift is going through the medical notes. By midday or 1 p.m, the doctors will already have a management plan written down for each patient, and these are basically the list of tasks that you need to do throughout the shift. Especially as a student nurse, you may feel out of place since you're not actually qualified. You'll feel like there's not much that you can do, but I promise you, especially in the NHS, there are so many tasks that you can participate in, even if that's a bed bath for a patient. Doing a bed bath with a patient and a healthcare assistant, you are engaging in patient communication and interaction. You could also assess the patient's skin, and this is building on your nursing clinical skills. You're participating in conducting moving and handling. Also, teamwork is important, and you are part of the team when you're working in your placements. So guys, I think that's all the advice and the pros of working as a nurse in the NHS from me. If you guys have any more, then please let me know on the comment section down below. I'm sure other nurses are eager to know. If you have any other questions, then you can ask in the comment section down below. And also, if you have Instagram, you can follow me for nursing and medical advice, knowledge, experience, lifestyle on my Instagram page. I'll leave my Instagram handle in the description box below. Please do subscribe if you already haven't for more nursing lifestyle videos. Press a thumbs up if you like this video. Don't forget to share. I'll see you guys in another video. Bye.